Which came first, the chicken or the egg? In joint pain, we ask the same. Is the bone spur the problem or just the body's reaction? Too often, the advice is shave it down, cut it out. But bone spurs, bursitis, and cysts usually appear because something deeper has failed, like a tendon, ligament, or joint surface. Removing them doesn't restore performance or keep you active long term. At Pain Experts, I take a precision-guided approach, using your own biology, platelet-rich plasma, or bone marrow concentrate. I target the real structures that need support. These treatments don't burn or cut tissue. They help reinforce and repair it. This isn't just about pain relief. It's about keeping you powerful in the boardroom, on the court, or wherever excellence matters most. We're not chasing symptoms. We're helping your body repair the foundation. If you've been told surgery is your only option for a spur, cyst, or bursitis, pause, ask instead, why is it there? Schedule a private consultation, and let's build a regenerative plan that keeps you moving at the level you expect.